Early palliative care, different for people with different conditions. So this talks about the rationale for early palliative care. It's that there are 3 typical illness trajectories, each with 4 dimensions towards the end of life. Early palliative care may prolong as well as improve life's quality by promoting realistic medicine, and many people can benefit from early palliative care, meeting the likely needs of people with advanced illnesses. So what does early palliative care look like for people with different illness trajectories? Well, there are 3 main typical trajectories of physical decline at the end of life. The rapid decline, typically of cancer, intermittent decline, typically organ failure, and the gradual one, typically frailty or dementia. But dying, of course, is a 4-dimensional experience, at least physical, psychological, social, and spiritual or existential. So let's look at the rapid trajectory first, typically cancer. Well, the physical decline we've seen coming towards the end quite rapidly, quite often. And the social decline tends to run in parallel, we'll find through many research interviews. However, the psychological distress and anxiety and worry tend to be worse at 4 times around diagnosis, after treatment, recurrence, and around death, similar times that existential issues may be expected. So the message for the rapid trajectory: people with cancer need an early palliative approach, even when they may be physically well. Other dimensions may actually be causing the acute distress, anxiety. So simply acknowledging anxiety from the beginning is really appreciated by people. So in the intermittent trajectory of organ failure, what's happening there? Well, the physical trajectory has these dips. Physical decline is episodic, usually followed by partial recovery. Sudden death may appear at one of the dips or between. And social decline and psychological decline often runs in parallel with the physical decline. Spiritual decline is harder to define exactly what's happening there. It can be moderated by various aspects. So the message for people on the intermittent trajectory: early interventions that address psychological and social issues may be more effective than actually addressing just the physical. And similarly, preventing things, it's good to consider these other trajectories. The gradual decline trajectory, let's look at that one now, typically frailty. So here we go, the gradual physical decline over many years, many months or years. And looking at the social decline, it and the psychological decline and even the existential distress, these often dip, in fact, before the end. Sometimes these dimensions can decline and can be seen that. Maybe someone has a problem before. So the message for that is support people in these other dimensions, not just the physical, to promote resilience, to prevent anxieties. Address the racist fears, which may be loss of dependence, dementia, or being a burden, rather than actually dying, of course. So the plan ahead for helping people at the end of life. For early palliative care, identify people early. Look at the different dimensions of need and maybe talk to them about what might happen. Discuss the trajectories with the people in their care and map them out, letting them understand what's happening, and plan integrated care ongoing with disease management and communicate the plans everywhere. Thank you.